Another great method is laser light therapy. Now we have two delivery modes. We have a pad and a probe, which we will use on your lower spine to treat the source at the spinal cord level. But we also have a special boot or an anodyne therapy that is a light that is surrounding the lower extremity that we have you wear there as well. And we use the light therapy, laser, and oxygen decompression. In addition, we also do corrective chiropractic care for misalignments of the spine, and we do neurological rehabilitation. So what we'll do is examine you. We'll find that you have a neurological deficit on one or other side of the body, and we will do neurological brain-based rehabilitation as well. Now, another key component to our protocol is nerve mobilization. Now, nerve mobilization is just as it sounds. The nerve comes out the lower back and down into the legs, and it crosses through a lot of fascia, a lot of tissue, a lot of muscle, and it can get caught in old injuries like a hamstring pull or a bruise or a broken leg or shin splints or what have you. And what we'll do is test you for these adverse neural tension points. And we have a specially trained massage therapist who will spend enough time as necessary in repeated sessions to actually mobilize the nervous system, whether it be with cross-tissue cross-frictional massage, specialized stretching, and we will actually flush the nerve and stretch it and free it up into its adhesions. And so now the nerve is gliding, it is relaxed, and there's slack in it. It will improve the circulation and it will improve the nourishment in there. Right. So on a typical visit, what we would do is first examine our patients. So the exam would include reviewing all recent blood work or sending out for a complete blood panel. We would check for anemias, we would check for blood sugar disorders, we would check for digestive disorders, we would check for your hemoglobin, hematocrit scores, and we would check your tissue saturation of oxygen and your tissue perfusion. So what we do is see how much capacity you have to carry oxygen and how good the delivery system is. And what a good delivery system is a 3.5 to 4.0 perfusion and a 98 to 100% saturation. Frequently, our peripheral neuropathy patients have perfusion scores less than 1, and that's very poor circulation. And their saturations are 96, 94, 92, and so forth. And this is frequently, unfortunately, caused, like I said, by anemias caused by lack of acidity in the stomach, caused by antacids, high blood pressure medication, and unfortunately statin drugs. Now I advise you not to go off these medications without consulting your doctors, or more importantly not understanding why these medication needs are there and addressing them before you lower those medications. So our protocol works slowly over time to wean off of medication. It should never be done by yourself suddenly without the supervision of your physician. All right? So I just want to make that clear. But after we examine you, we also do a neurological exam where we will have a scoring system developed in Toronto that will grade all the peripheral nervous tissues sensibilities: cold, prick, warm, touch, vibration, and so forth. And a perfect score is 76, so we'll grade you against that score, and we'll be able to monitor that on successive examinations to see how your neuropathy is improving. So after we do the initial blood work, we'll also do the mechanical exam. We'll review your MRIs, we'll take x-rays, we'll do a neurological, mechanical, and metabolic review of your systems, and come up with a protocol and recommendation for care. But if we accept you as a patient for care and you're a good candidate for the program, we'll first go over the nutritional recommendations to manage your case on the home front, both including nutritional supplements and diet changes. We will then recommend glutathione therapy to do at home. And then here in the office, our typical protocol would be for a patient to come in, lay down on a chiropractic bench, you will receive a chiropractic adjustment to realign the spine, decrease muscle tension, and neurologically balance the cerebellum. After that session of a few minutes, you will be then sent over to receive decompression therapy. Now, decompression lasts about 10 to 12 minutes. While you're being pulled and relaxed, you'll be breathing concentrated oxygen and receiving vibration. After that session, you will then lay on a laser pad for the lumbar spine and also receive some additional vibration for 10 minutes. And then you will receive the anodyne or the boot laser therapy directly on the feet to circulate and re-stimulate the nerve growth in those areas. While you're receiving the anodyne or the boot therapy, you also will be receiving concentrated oxygen in addition. So our program is very comprehensive both here in the office and at home. And if you're a good candidate and you are interested in learning more about this, please call the number on this website and we'll be happy to discuss it with you further if you'd like to get examined. Thank you very much.
I think that back pain affects all qualities of life.
I would be, I'm sure, very irritable and not much fun to be around.
My back pain keeps me from doing things that I normally do.
I was actually training for a marathon.
Overall, it keeps me kind of slowed down.
Used to be able to run, 25, 26 miles, and it was reduced down to maybe 3.
I would have to take too many over-the-counter medications.
It gets to the point where sometimes it's a shooting pain.
A constant ache down the back of my leg and a lot of discomfort.
Causes headaches, and I have difficulty turning my neck.
It's just always there, and there's always an underlayment of pain that rises and comes back daily.
Frustrated with back pain? Feeling like you're enduring life rather than enjoying it? Well, you're not alone. More than 65 million Americans will experience back problems this year. Only the common cold causes more people to miss work. And you're not alone if you've spent hundreds or even thousands of dollars on treatments and medication. This year alone, Americans will spend more than $50 billion treating back and neck-related pain, many times only experiencing temporary relief. What if you could finally get more permanent relief? What if there was an alternative to medication, painful exercises, bed rests, and surgery? What if you could finally enjoy your life again? The great news is, you can. How? With DTS Spinal Decompression Therapy, a leading non-surgical alternative for disc-related syndromes of the lumbar and cervical spine. This comprehensive treatment has already proven effective for back pain sufferers around the world. In fact, many patients feel relief after their very first therapy session, and some 7 out of 10 patients who complete their treatments walk away with their back pain totally eliminated. So you're not alone in your back pain, and now you're not alone in starting this exciting new therapy. You're joining thousands of people who are experiencing back pain relief thanks to DTS Spinal Decompression Therapy, the safe, comfortable, and long-term solution to your back pain.
Every time I come off the DTS table, I do feel much better.
I think it can have a great impact on a lot of people's lives, just like it has on mine.
There is a therapy that can help those problems in their neck without surgery, without drugs, that's safe, and it works.
You can feel confident knowing that the developer of this revolutionary decompressive treatment is the world leader in physical therapy equipment design, with over 8,000 systems installed worldwide. Although DTS systems have primarily been used in hospitals, now, through advancements in manufacturing technology, DTS therapy is also available in many clinics and private practices. In many cases, back pain is the result of an accident or injury. In others, pain has resulted from day-to-day stress and simply develops over time.
I always attribute it to just getting older. One of the things that I assumed everyone went through. And then when I realized that it's actually a compression problem in my neck, that I don't have to feel like that.